Okay, good evening. I want to welcome everyone to our talk tonight, A Day in the Life of a Physician in the Renaissance by Dr. Philip Goscienski. My name is Stephanie Sandoval, and I'm the Public Archaeology Director at the San Diego Archaeological Center. The center is a nonprofit dedicated to the preservation of local archaeological collections. In addition to our state-of-the-art curation and research facility, we also have a museum. Unfortunately, it's currently closed. And focus on providing high quality educational programs for both kids and adults. I want to thank all who generously supported us on Giving Tuesday. If you didn't have a chance, it's not too late. Donations and memberships to nonprofits like the center make great holiday gifts. Please visit our website for more information on the center, membership options, and upcoming events like our next living room lecture. We have on Thursday, January 27th, Ironworking in Togo, West Africa, Archaeological Research from 2013 to 2020 by Dr. Philip de Barros. Information and registration can be found on our website at sandiegoarchaeology.org. Tonight, we will be using the Q&A feature. You can find it on your Zoom control panel. Feel free to submit your questions at any time during the presentation, but Dr. Goscienski will answer those at the end. I'm very pleased to have Dr. Goscienski back with us again. He has been a wonderful supporter of the center for many years. He has worked for almost 50 years as a pediatric infectious disease specialist and reached the rank of captain in the United States Navy Medical Corps. He is a prolific author on various topics and draws on his wide range of interests from biology to anthropology in developing his Better Life seminars. So without further ado, I will welcome Dr. Goscienski.
Well, thank you very much. It's a pleasure to be here again. The Archaeological Center is one of my favorite places I love to visit, and it's a pleasure to share some of my knowledge with the members who support the center. Well, the Renaissance was a rather remarkable period in history, as pretty much everybody knows. And the term Renaissance comes from the Latin word nascere. And the Italian was rinascere, which is to be born again or to revive. And a writer named Vasari was the one who coined the term rinascita, which we transliterate as Renaissance. And if you're French, then you probably know that renaître is to revive, and naissance is birth, and that's again where the word that we're so familiar came from. If we look at the timeline of the Renaissance, traditionally it's said to begin in the early 14th century in Florence, Italy, but probably it began earlier with the writing of Dante in the late 13th century and later developed in various parts of Europe. Now, we tend to associate the Renaissance with Italy, but it certainly was something that was a very prominent phenomenon in all of Europe, including places like Russia. One of the early artists of the Renaissance was Giotto di Bondone. And he must have been an interesting character, because even this statue that memorialized him shows him with a very stern countenance. And he was someone who brought a little more action to art in those days. And this is a section of one of his paintings of Christ driving out the moneylenders in the temple. And as you can see, it's not as stiff and formal as some were before then. And of course, when people like Michelangelo arrived, the Renaissance took a very dramatic turn in terms of realism and beauty. And it just generated an art form that probably has never been duplicated since that time. I mentioned that the Renaissance went beyond Italy. It was the period of Queen Elizabeth I, as a matter of fact. William Shakespeare was part of that phenomenon. And so was Miguel Cervantes, who was, as you know, the author of Don Quixote. Martin Luther came on the scene at that time. One of the reasons being that the Renaissance was a period that was marked by overturning tradition, which is one of the reasons why it succeeded so well. And of course, there are a few people who had such an impact on the world as Christopher Columbus. because this whole period was an age when old ideas were being discarded and dogma was being replaced with a scientific method, which for 2,000 years had not really been a part of science at all. Now, there are some things that influenced the Renaissance and how it developed. One of those, of course, was the Crusades. The Crusades began in the 13th century, and they lasted for a couple of hundred years. But of course, during the Crusades, there was a great deal of commerce, a great deal of military activity, of course, and a great deal of interaction between the East and Europe. One of the most phenomenal events of this was the conquest of Constantinople by the Turks, in which massive numbers of scholars left to go to Italy, mostly. And then, of course, there were the discoveries of Copernicus and Galileo, which turned science on its head. Certainly was a huge problem for the authorities at the time, mostly of the church. Since the printing press was developed in the early part of the Renaissance, that obviously gave great impetus to movement of the area. I mentioned Christopher Columbus, but he was preceded, of course, by a number of other individuals who explored especially the coast of Africa, and finally went around the Cape of Good Hope in Africa to explore the Indian Ocean. And we'll be talking a little bit too about the Black Death, which occurred in the middle of the 14th century, which had an enormous impact, not only on that era, but has had an impact ever since that time. The Crusades, of course, began even before the Renaissance did, but lasted for 4 centuries. And there were a lot of reasons for the crusade, and the reasons are usually given as religious, but there were really more than that. There were some political reasons as well. What it did do, however, is expanded the body of trade between the Mediterranean area and the areas to the east. One of the things, too, it helped to enrich Genoa and Venice. Venice, interestingly enough, became a financial powerhouse, not because of the trade that occurred during the Crusades, but something that occurred even earlier. The merchants of Venice developed the salt industry. Salt was a very important commodity in that time, and because they gained control of all the salt-making facilities in that part of the world and monopolized them, it gave them a tremendous financial leverage, which they then used to catapult themselves into the financial powerhouse that they became during the Renaissance. The Crusades, of course, had great influence on art and literature because they increased the interaction between two parts of the world. And finally, this all ended when Constantinople was conquered by the Muslims in 1453, which led to other problems as well. When the Turks conquered Constantinople, many of the scholars feared for their livelihood and their lives, and they left, and many of them went to northern Italy. And these were some of the kinds of people who left Constantinople. And as you can see from this list, it was people like this who had enormous influence on what was to come in the next couple of centuries. Not only people like printers who helped to spread the word, but lecturers as well, philosophers, politicians, theologians, people whose influence we still see today. And if you've ever been to Italy and in Europe, you can witness it even now. War, of course, was something that went on pretty much constantly during that period. And it's true that diseases killed more soldiers than weapons until the 20th century. As an example, when Santa Lucia was invaded, the army of 1,500 was decimated by yellow fever and malaria. And because of those diseases which could not be controlled, the same thing happened during a slave revolt in Haiti and the Dominican Republic, area known as Hispaniola. And because it tied up the finances of Napoleon, it made it possible for the United States to acquire the Louisiana Purchase. And it's really hard to imagine how important that was, considering that the territory of the Louisiana Purchase goes far beyond Louisiana, but goes up into southern Canada and literally constitutes about 1/3 of what is now the United States. The development of firearms, of course, had a profound influence and changed the way wars were fought and led to different methods of treatment. And these were some of the kinds of things that were used in those days. Wine, because it was felt to be curative and hold down infection, which it did in a sense, but mostly because it irrigated out the damaging organisms rather than kill them. Oil, of course, was something that was felt to have healing properties. Honey was used, and things like crushed onions and salt. Pretty hard to imagine people having crushed onions and salt put into their war wounds, but that's really what they did during those days. There was what I refer to as a hierarchy of healers, because physicians as we know them today certainly did not exist back then. There were the physicians who were trained in universities. They were mostly religious people, and they were referred to as surgeons of the long robe because, in fact, they did wear a long robe to designate their status. There were the barber surgeons who didn't have any formal training, but usually were apprenticed to someone and got on-the-job training, and they were called surgeons of the short robe. They were, in fact, not allowed to wear a longer robe to designate the difference in the classes. Of course, there were people who dispensed drugs, the apothecaries, and midwives. And midwives, of course, are at the bottom of the list. And even in the modern world, midwives, unfortunately, are at the bottom of the professional list of healthcare providers, even though their experience is remarkable. And during the Renaissance, they were very much needed because the physicians simply didn't lower themselves to do things like deliver babies. There were some other specialists at the time, and what I mentioned that war was common, so that bone setters were often called into use. But of course, there were all kinds of other ways of being injured at those days. So people who could heal fractures were pretty important. There were some people called lithotomists. Lithos is a Greek word for stone. And these were people who removed things like bladder stones. And I will not describe what that procedure was like because we're so close to dinner time, but it was a really very primitive, brutal procedure, extremely painful, but bladder stones are too, and some people were willing to undergo that procedure in order to relieve future problems. Now, you wouldn't think that someone like an ophthalmologist would be very popular in those days because of what we know of them now is that they are highly trained surgeons. At the time, they were called oculists, and they were people who actually performed cataract surgery. And the way they did this was they pushed the lens deeper into the eyeball. This is an example of a cataract. And you don't see this kind of cataract anymore because the cataract surgery that we have available now is so common and so simple that a cataract is not allowed to progress to this stage in which the lens is completely opacified. And the method of treating at that time was shown in this drawing, in which the patient is sitting up and the oculist, what we would call now an ophthalmologist, literally pokes a needle through the cornea into the eyeball and pushes the lens out of the support that it has within the eye. And because the patient is sitting up, the lens simply drops down to the bottom of the eyeball. Now, of course, if you don't have a lens, your vision is not real good, but it's not real bad either. And at least you can see somewhat. You may not be able to read text, but you can recognize people, you can see movement around you, because the light now is able to pass from the front of the eye, through the cornea, through the opening in the iris where the lens used to be, back through the eyeball into the retina where an image is maintained. And so this was a standard way of treatment, would you believe, until about 1980. It wasn't until late in the 20th century that this kind of surgery came into being. This is how cataract is treated now. And it's a procedure that literally takes about 10 or 15 minutes under local anesthesia. And in this situation, the ophthalmologist actually removes the lens and replaces it with another. So now people who have undergone this kind of surgery have absolutely perfect vision. And there are now lenses that serve both for distant vision and close vision, so that one does not have to have different lenses in each eye, as so many of us do. The term cataract is interesting. It comes from the word waterfall. And if you refer back to the image I showed of an eye with an opaque lens, and the lens has a kind of a whitish, grayish, foamy appearance, well, a couple of thousand years ago, those cataracts resembled a foamy waterfall. And that's where the name cataract came from. And interesting enough, cataract is still the most common cause of blindness in adults in the undeveloped world, even though the procedure is now so simple and so inexpensive. I mentioned barber surgeons a little while ago, and these people's profession originated in monasteries about 1000 AD. And for the next several centuries, these were primarily people who, the physicians for the next several centuries gave advice and supervised others, but physicians didn't provide surgery. They left that messy stuff to the barber surgeon. And these were some of the things that the barber surgeons did, things like bloodletting and cupping, tooth extraction, hair cutting, shaving, and enemas, and they literally treated people from stem to stern. If you wonder what cupping is something that I'll describe in just a moment, but it's something that's still practiced today. And of course, they got a lot of experience during wartime because there were wars going on virtually all the time during the Renaissance. And they got very good at treating injuries and actually performing amputations, which the physicians did not do. Now, if you remember a symbol that was very common in the 19th and 20th century of the Barber Pole, this was a pole with circular red and white stripes, and that was developed in the Renaissance because it represented blood and bandages, the blood being the red, of course, and the bandages being the white, but this was a symbol of barber surgeons at that time. I mentioned cupping. Cupping is a phenomenon that is still present in much of the Eastern countries. And each of these cups or vessels is heated and applied to the skin. And it, as the cup cools, because the air inside it cools, it creates a vacuum. That vacuum then sucks the skin into it, and the theory was it sucks out the evil humors that are causing disease. And when the boat people from Vietnam came here in the 1970s, many of them, of course, arrived in the United States. People were still treating children, for instance, with various illnesses with cupping. And so kids would be taken to the emergency room when cupping didn't work. And they had these bruises all over them. And sometimes Child Protective Services were called, thinking that these kids were the subjects of child abuse, when in fact, this was just traditional medicine that's practiced in the Far East. Well, one of the things that characterized the Renaissance was the overthrowing of authority. And one example of this was the overthrowing of the teachings of a physician as Galen, a Roman physician of the 2nd century, and he was he was an excellent PR person. He was very learned, very scholarly individual. He wrote a great deal. And unfortunately, a lot of what he wrote about was simply wrong. Much of his medical practice was based on the ideas of the Hippocratic humors, which had been devised some 1,000 years earlier. But his teaching was so convincing that physicians were still basing their treatments based on what he said for about 1,200 years. And it wasn't until the time of the Renaissance that the teachings of Galen were finally overthrown. One of the people who did this was a physician named Vesalius. And he lived early in the 16th century, and he was willing to do autopsy studies. And he found that what Galen had taught in the second century, 1,000 years earlier, was simply wrong, because Galen based his anatomical studies on chimpanzees, because it was not allowed to do autopsies on humans in those days. This is a panel from the publication of Vesalius, which described his anatomic findings. And he is the person who kind of opened the door to the scientific method and literally dislodged the old teaching of Galen. And one of the things that Vesalius did, he recognized that the pulse actually reflected the heartbeat. And his studies paved the way for these studies of the circulatory system, which would be finally explained in a couple of centuries later. And Vesalius also recognized that the brain, not the heart, was the center of the mind and of the emotions. I'm sure that he got much of his information from barber surgeons who treated war wounds involving the head, realized that damage to the brain did great damage to the mind and to the emotions as well. And they realized that the brain was the center of these functions and not the heart. Vesalius also showed that nerves are not hollow, which was something that Galen had taught. How they did not realize that over the centuries of treating war injuries is beyond me, but he certainly put that to rest. Another famous person was Ambrose Parray. Ambrose Parray lived in the 16th century, and he was a barber surgeon because he was apparently not allowed to enter medical college. But he had wide experience because of his wartime experience. And that experience was enough to make him an extremely highly esteemed person during that age. And one of the things that he found was that typically when wounds were sustained on the battlefield, the barber surgeon would pour hot oil over the wound in order to prevent infection. But one time he ran out of oil, and he found that the patients who did not get treated with that hot oil did better and had a higher survival rate than the people who were treated with oil. And again, that was one of the things that came out of his studies during his battlefield experience. Well, one of the questions that comes up is, why didn't people know how blood circulates and how important the heart was? And it wasn't until the early 1600s that people figured out how the circulation worked, because the heart was long thought to be the seat of the soul. Now, we have to remember that until about the 16th century, late in the 16th century, there were no microscopes. And people could not see the capillaries which connected arteries and veins. And therefore, there was no way for them to really understand how blood went from arteries to veins. And they thought that the blood kind of sloshed around in those two systems. And they simply could not explain how that worked. However, a physician named William Harvey, who was a very well-known physician, figured out how this happened. And he was the one who ultimately determined how the blood circulates, which made an enormous difference in how medicine was practiced in the centuries that followed that. Well, hospitals have been around for a long time. Hospitals originated in India back in the 5th century BC, And they were primarily intended to provide care for poor people and for people with contagious diseases. And that was a practical basis because these people could otherwise spread more disease in their communities. And so they were eventually funded by municipalities to take care of these people. And by the time of the Renaissance in Europe, they were pretty well established. And this is an example of one of the largest hospitals in Italy. This is Hospitale Maggiore in Milan. And the size of this place is enormous, but it was very well organized and has some interesting facilities. It was also a place for abandoned babies. And what happened was at the door or the gate of the hospital, there was a horizontal wheel, half of which was inside the gate and half of which was outside, so that mothers could place a baby on the wheel if they want to abandon the baby, but did not want to simply allow the baby to die. They could place the baby on the wheel, give the wheel a half turn, and the baby would end up inside the hospital and the mother would never be recognized. Well, it's interesting that this kind of thing is present even now. Many hospitals in virtually every city have similar provisions so that mothers can simply drop off their children, no questions asked, so that those babies can survive. Well, as a pediatrician, I'm very familiar with this image, and this was one of the sculptures, of which there are several around this hospital called Ospedale degli Innocenti in Florence. And this was a sculpture by Della Robbia, who was a famous sculptor of the time. And that image was eventually incorporated into the logo of the American Academy of Pediatrics. And this is now familiar to every pediatrician. Well, there were some interesting diseases during the Renaissance era. One of the most common was gastroenteritis, which we tend to know as diarrhea. And it was the leading cause of infant mortality actually until early in the 20th century. And it was the leading cause throughout that period because they simply did not understand what sanitation was like. And they didn't realize that germs could be spread through contaminated water. Pneumonia was also very common, and insect-borne diseases were very common as well. Some of the major ones were things like plague, which I'll discuss shortly, typhus, which was also very common during that period, and malaria. Malaria is one of those diseases which was not understood for a very long time. It was felt to be due to simply bad air or malaria, which is where the name came from. I mentioned gastroenteritis as being so common, and there are literally scores, if not hundreds, of different germs, viruses, and bacteria, and some parasites that cause things like vomiting and diarrhea. And this disease did become common until the onset of the agricultural revolution, because that's when people began to cluster in small groups and villages and later towns and cities. And they didn't have a clue about hygiene. They had no idea that you can't put a source of water close to an area where sewage accumulates. And so this was an inevitable result of that revolution. Now, to put this in perspective, you have to keep in mind that what we consider as modern plumbing is only 3 generations old, because if most of us talk to our grandparents, we'd probably be told that, yeah, they didn't have an indoor toilet when they were growing up, because most people lived in, number one, most people didn't live in cities. They lived in smaller towns and on farms, and outhouses were pretty common. As a matter of fact, when I was growing up, I had 3 cousins, all girls, who lived in a small town, and they had an outhouse. And I can't tell you how I dreaded having to make the usual family visits to visit that family, because I knew if we were going to be there for very long, I was going to have to use the outhouse, and I really hated that. But remember, that was only less than a century ago, a good deal less than a century ago. Now, commodes were present among the aristocracy. So what did the simple folks do? They simply dumped whatever they needed until they could drop them out, the contents out the window, right into the street, literally, or use open sewers. Because for the most people who lived during the Renaissance, there was no indoor plumbing. And they simply did their duty outdoors. And that meant water sources were often contaminated. And when they had to empty their bowels or bladder in the nighttime or during cold weather, that was a chamber pot. But they didn't empty those chamber pots until they were about full and didn't hold much else. And often, as you may have read if you're a student of history, those chamber pots were simply dumped out the window into the street, and pity the person who was walking by at the time. They did have sewers, and the sewers were often flushed. However, they could be open for long distances, and travelers in cities during that time were well aware of the horrible odors that filled that area. Well, we come to the Black Death. And the Black Death is one of those phenomenon that really is the hallmark of the Renaissance in terms of medical issues. The Black Death arrived in the port cities in Sicily and Genoa in about 1347, and it didn't go away for a very long time. Once the Black Death or plague had arrived in Europe, it lasted for several hundred years. And as a matter of fact, it still is present in the 20th century. And I'll give some examples of that. What happened was that the rats aboard the ship escaped into the city, and they brought the fleas with them. And when the fleas bit people and transmitted the disease, they caused a disease which had a very high mortality rate, and certainly in some areas 50, 60, maybe 80%. The phenomenon of the Black Death actually influenced medicine during that period, certainly had an effect on commerce. You can probably think of images of artwork that you see from the Renaissance that depicted some of the devastating results of the Black Death. The Black Death also gave rise to the word quarantine, because when ships after 1347 arrived in Italy, for instance, they were not allowed to come to the docks to discharge their passengers and crew and the goods that they carried. They were forced to stay in the harbor for 40 days. And the Latin term, the Italian term for 40 is quaranta, and that was the origin of the term quarantine. Now, at that time, it was 40 days. However, the term quarantine is much different now, and we're certainly very well aware of the term quarantine now with this current coronavirus pandemic. And quarantine now means 14 days. The CDC says, well, maybe it only has to be 10 to 12 days. They still haven't made up their mind on that. But the term quarantine means something very different than 40 as it did a few hundred years ago. Now, it's interesting that they did have some insights into to this, because when plague recurred in Venice, it was recognized that people who had the plague, when the new plague came along, they didn't get the disease again. And what happened was the doges of the city actually recruited the oldest physicians who had survived that epidemic, and they were told that they were the ones who had to care for these people because they would not become ill from the disease. And they were, in a sense, vaccinated against the plague. This is what those physicians looked like. Now, remember, I used the term physicians of the long robes. These were the academic physicians, not the barber surgeons, and their uniform, as it were, was this long robe with the long sleeves. It has some practicality because it kept them from becoming contaminated with fluids from patients. And they knew that those fluids could somehow transmit disease, although they had no idea what the germ theory was. And as you can see, he's holding a wand in his hand. Well, in those days, physicians wouldn't lower themselves to actually touch patients. So they would poke them and prod them if they want to get a better look at something. And that's why they used the wand. The hat was probably just part of the fashion of the day, but that beak was something quite different. And the beak had a purpose, had two purposes, actually. The beak was filled with two kinds of herbs. One kind of herb was very fragrant, which could mask the terrible odors that were associated with all the dead bodies that these people encountered. And there were other herbs in that beak, which were felt to possibly to protect them from the disease, which of course they did not, but at least it helped them to make their way among the horrible stench of literally hundreds and thousands of bodies. Well, plague, as I mentioned, is still around. There have been outbreaks of what we call classic plagues in various parts of the world. And in Madagascar, for instance, which is a very large island off the coast of Africa, there have been outbreaks that have killed dozens of people that began in 2014. Plague is still present in various parts of the American Southwest. And if you've ever traveled up to Palomar Mountain and the park in that area, from time to time, you may see signs posted by the park rangers telling you not to come near or to feed or to handle either live or dead bodies of ground squirrels, because ground squirrels carry the plague bacillus. And in 2015, for instance, an adult died in southern Colorado of the plague, presumably contracted from ground squirrels. And in that same year, a child who had been visiting Yosemite and came back to LA was admitted to an emergency room in LA County because she had contracted the plague in Yosemite. And there have been episodes in Yosemite where some of the campgrounds have been shut down because the plague has been present in the area. Well, how does plague appear? Well, it causes hemorrhages into the skin, which take on a black appearance. And one would think that the term Black Death came from that term, but it really didn't. The term Black Death didn't come up until very late in the Renaissance. And it's known also as bubonic plague. And a bubo is a swelling of a lymph node, sometimes to the size of a softball, just can become enormous. And the reason this occurs is because the lymph nodes, what we refer to in the neck when we have a sore throat as swollen glands, occur in many parts of the body. They are common in the groin, for instance, and in the armpit as well as the neck. But the classic bubo of the Black Death appear in the groin because when you're bitten by a flea, you're likely to be bitten on the ankles. And when the flea injects the bacillus that causes the plague into your skin of the ankle, it makes its way up into what's called the lymphatic system, which is a channel of fluid which carries infected material from the site of infection up to those nodes. Those lymph nodes, for instance, are masses of immune cells. And if you're lucky, they will be strong enough to halt the infection. And if you're not lucky, as those people were during the Black Death, those lymph nodes will become enormously swollen. And sometimes they will actually burst and release this foul-smelling pus, which was well known back in those days. And so this was where the term bubonic plague came from. Sometimes the plague bacillus spreads from those lymph nodes or buboes to the bloodstream and then to the lungs. And when it invades the lungs, it causes a severe pneumonia called pneumonic plague, which is not only rapidly fatal, but which also spreads from one person to another. And so when people start coughing with this pneumonic plague, that increases the rate of infection within a population. And that's one of the reasons that the plague can spread even if people are not exposed to fleas and rats. Now, this what's called septicemic plague, when it spreads into the bloodstream, not just the lungs, it can spread all over and cause enormous damage and cause what's called septic shock. And it is typically fatal. Almost no one can survive the septicemic form of the disease. Well, another common disease during that time was typhus. Typhus is a disease spread by lice and fleas, and it's a disease that is characterized by crowding and poverty. And the term typhus comes from the Greek word smoky. Well, you wonder where that came from. Well, typhus causes a disease in which the brain becomes foggy, and typically it leads to a delirium type of effect where people don't recognize what's going on around them. And so this term smoky, or typhus in Greek, came to denote the disease. The typical clinical picture is that people become comatose after they go through this period of disorientation. Then they get heart failure and kidney failure, and finally they die of the complications of those two problems. But typically, typhus is something that occurs in wartime. And it is common in groups of people who are crowded together, typically of refugees and people in prisons, for instance, and concentration camps, and places like that where people are poorly nourished, crowded together, and have no sanitary facilities and can't bathe. Therefore, they are invaded by fleas and lice, and they become infected with the germ that causes typhus. Well, it was interesting that typhus affected the outcome of a war, because when the French tried to invade Italy in the 16th century, their forces were hit by typhus, and their force went from 25,000 men to 4,000 within a matter of weeks. And they were completely unable to fight, obviously, and they had to retreat from Italy. Well, I want to explain the daytime routine of a physician in Florence, which, as you know, in Italian is Firenze. And this physician is named Dr. Antonio Darmino. Dr. Darmino studied in Bologna, and for several years he was an army surgeon working for the Duke of Florence. When he left the Duke's employee, he had a suite of rooms in his residence that included an operating area, so that he was able to see patients, operate on them, and didn't have very much of a commute. Well, when we look at what his patients were like for the day, one of the first patients that he saw was an 18-year-old who, kind of typical of 18-year-olds, got into a fight, got into a knife fight actually, and was stabbed in the arm. So Dr. Darmino irrigated that wound with warm wine, and he allowed it to heal, because he knew that, number one, if he irrigated the area with water, the water might be contaminated and cause an infection. But wine was not likely to be contaminated, so it would promote healing. He also noted if he didn't sew this wound up, it would heal better. Because in his wartime experience, he realized that when a physician or a barber surgeon would sew up an injury, it likely would result in gangrene of the arm or leg. And the reason is that the germs that particularly cause that type of gangrene would thrive in a damaged area of tissue. Another patient that I saw was a 28-year-old, and this poor guy had his leg crushed when a wagon rolled over him. Dr. Darmino realized that he would have to amputate the leg because there's no way to save it. And this poor patient had no anesthesia. at least not the kind of anesthesia we now know, because the only anesthetic that they had was something called laudanum, which is an opium derivative, and henbane, which is an herbal product, which does have some anesthetic qualities. Now, when he operated on him and he cut off the lower leg, he used a new technique that he had learned during wartime by tying off the blood vessels instead of cauterizing them. Because up until that time, when a wound was treated or a leg was amputated, the stump was treated by pressing red hot iron against it to burn the bleeding blood vessels, and they would seal off, and there would be no further loss of blood. Well, obviously, henbane or laudanum or not, that was an extremely painful situation, but Dr. Darmino simply tied off those bleeding vessels instead of cauterizing them. Well, I mentioned that he left the wound open on purpose, and one of the reasons was because he knew from his battlefield experience of two conditions. One was gangrene, in which the limb literally rots, and tetanus, which is a generalized disease which causes spasm of the nervous system and often paralysis of the breathing apparatus. Now, both of these diseases were caused by particular germs belonging to kind of the same family or genus, but different species. And they were both common in soil. And they grow best in areas that have a lack of oxygen, and they are literally killed when they are exposed to high levels of oxygen. Well, what is typical when an arm or leg is crushed or is subject to being punctured by something like a thorn or a needle, that area doesn't receive very much oxygen because of the vessels that are damaged in the course of the injury. And the lack of oxygen allowed those bacteria to grow very luxuriantly and produce toxins that would do the damage. Now, you have to remember that in terms of a battlefield injury, those wounds are always contaminated. There are no sterile battlefields. And when an accident occurs, as the young man whose cart rolled over him, that cartwheel is also dirty and introduces germs into that area. And the fact is, just like today's motor vehicle injuries, which are also contaminated, they carry those germs into them through that dirt. Now, one of the treatments that is typical of that kind of injury is removal of the dead tissue, because when that dead tissue is removed, the tissue that is left has a pretty normal blood supply carrying oxygen, and therefore the gangrene is eliminated. If you've ever been to an emergency room because you have had an injury from a motor vehicle accident or something else, maybe you cut yourself working out in the yard, when you go to the emergency room, they're going to ask you when you had your last tetanus shot. And if you don't know, or if it's been more than 5 years, they're going to give you a tetanus booster. And if you have a very widespread injury, multiple areas of damage, you might even get some additional medication to prevent that tetanus disease from occurring. Well, he made some house calls. And one of his first house calls was a 6-year-old child who had a high fever. And this child had a very painful sore throat and really looked sick. And even without approaching her bedside, as he entered the room, he knew that this poor child had diphtheria. Diphtheria was very common in the era before antibiotics and before vaccines. And diphtheria was something that was well known to physicians until the 20th century, because in the 20th century, in the 1920s and 30s, we had diphtheria vaccines, which eliminated the disease. But until then, it was so common that when a physician could take a sniff of the room, he knew what the disease was, and here's why. The term diphtheria comes from the Greek word diphthera, which means leather. And another iteration of that term is membrane. And what happens is in the course of the infection of the throat, a membrane forms at the back of the throat. And germs grow in that membrane, and they create this characteristic aroma or odor, which until just a couple of generations ago, every physician was familiar with. The problem with diphtheria is not necessarily always the membrane in the throat, although that can also cause obstruction to breathing and may cause a person to die because of an obstructed airway. However, diphtheria produces a toxin. And this toxin, in the days or weeks following the infection, can destroy the cells of the heart and the kidney and the nerves. And so the late complications of diphtheria are also well known, or were well known in those days. If you received a DPT shot when you were a kid, diphtheria, pertussis, tetanus, the D stands for diphtheria. The D is not against the germ. The D is against the toxin that causes the disease that's formed by the germ. And at this moment, there are probably people on this conference call that have the germ of diphtheria in their throats. Is very common. Most of the strains of diphtheria don't produce toxins, but there are a few that do. But if you've had that shot, that vaccine, you are prevented from getting that disease. Another house call that he made was a 12-year-old. And this was a child who had a rash, little blisters all over the body, and he diagnosed that this was chickenpox. Now, at that time, smallpox was often confused with chickenpox, but he knew that this child had chickenpox and not smallpox because he was aware that this lucky child had been variolated, had received something called variolation, and it was a form of vaccination against smallpox. And what happened in those days, and going back to the Chinese in like a couple of thousand years BC, Chinese and Persians and people who lived in Europe during the time of the Renaissance would take crusts from a healing smallpox lesion, someone who's recovering from the disease. They would grind it up into a powder, and they would literally blow it into the nose of the person who had not yet had smallpox. The person who got the smallpox dust in the nose would get a mild form of the disease and would be protected from the severe smallpox that might come around a year or 2 years or 10 years later. Well, the Chinese did it by blowing the dust from these crusts into the nose. The Persians did it by feeding those crusts to their kids. And finally, a physician named Edward Jenner in the late 18th century developed vaccination against smallpox, which many of us, if we were born before 1970, probably received, and we may still have a scar on our shoulder. Well, another house call that he made was a 50-year-old. And he diagnosed pneumonia because the person had fever and was having difficulty breathing. And the treatment at the time for pneumonia was bloodletting. And so he simply put a needle into this patient's arm, and he allowed blood to drip out into a container. And how did he know when enough blood had been taken out? Well, the patient passed out. Now, sometimes the patients didn't wake up again, but that was one of the hazards of that kind of treatment. However, even though bloodletting doesn't make any sense from a medical point of view, most of the time, sometimes it worked. Now, they used it for everything, but sometimes it worked in what appeared to be pneumonia, because sometimes pneumonia is actually confused with a condition called congestive heart failure, in which fluid floods the lungs, causing trouble breathing. And the physician seeing this, if he's not skilled, and they certainly were not very skilled, during the Renaissance, confused it with pneumonia. And so they let out some of the blood. Well, if you remove some blood from a patient with congestive heart failure, whose blood is backing up into the system, it relieves the pressure on the heart and the victim feels better. Now, that's obviously temporary, but the physicians of the hundreds of years prior to that time realized that sometimes bloodletting worked, and so they used it for just about everything. Even George Washington underwent bloodletting, and some historians feel that it helped to hasten his death. Well, this is what bloodletting is supposed to look like, but it really doesn't. To see an arc of blood looping out of the arm into a tray is not the way it works. If you open a vein, the blood simply kind of trickles out. If you open an artery, that's something different. The blood will come out under great force, even more than what's shown here. But this is a stylized example of what bloodletting was like. Well, as I mentioned, bloodletting was practiced for a very long time, and it was used in a wide variety of illness, and now it's still being used. There's a condition called hemochromatosis. This is a genetic defect that allows people to absorb more iron than their body should absorb. And the result of that accumulation of iron can cause problems in the liver, causing actually cirrhosis, and it can cause heart failure. And so we now can actually take blood out of patients with hemochromatosis and remove some of that iron to remove the toxic effects of the iron on the liver or the heart. There are other causes of hemochromatosis. One is in people who received a lot of blood transfusions. Some people who have leukemia, for instance, receive a lot of blood transfusions, and even though they might need it to survive for a period of time, can also cause excessive iron accumulation. There are some people who have excessive iron intake, and there are certain tribes in Africa, for instance, who cook in iron pots, and they cook acid foods, which releases iron into the food, and they end up with a very high intake of iron. And then, of course, there's the blood disorders, among which is hemochromatosis. There are a number of others, but we still use bloodletting now to relieve that problem. Well, he made another house call, and this was to his patron, the Duke. The Duke fell as he was working in his garden, and he smacked his cheek against a rock and got a large bruise on his cheek. So what happened was Dr. Darmino, who knew enough about leeches to carry him with him when he went to see a patient like this, applied leeches to that bruised area, and the leeches literally sucked out the blood from that bruise to accelerate the healing process. For those of you, when you were kids, who might have gone camping in lakes, for instance, especially in the Midwest and the East, you might have come out of the pond or lake with some leeches attached to you, and they can simply be brushed off, and it's no big deal. But leeches are actually still being used. And one of the examples of a keeper of the leeches during the Renaissance is shown in this woodcut. And this was a woman who specialized in applying leeches when they were needed. And this is a modern keeper of the leeches. This is possibly a plastic surgeon who has applied a leech to one of his patients. This is called Herodotherapy. And the leech called Herudo medicinalis was used as far back as 1500 BC by the ancient Egyptians. And it was used extensively in the Renaissance right up until the 19th century. And then it came back. And it came back in these situations of microsurgery, for instance, when plastic surgeons do what's called flap reconstruction. Sometimes putting those blood vessels back together again is difficult, even using a microscope as they often do now. And so they apply a leech to help drain off the excess blood or the fluid that accumulates. It's also used in reconstruction of the breast, for instance, because when the breast is removed, it interrupts the flow of fluid through those lymphatic channels I alluded to when we talked about the Black Death, and leeches are applied there. And sometimes when there's a traumatic injury or when a surgeon tries to reattach a finger or a toe using microsurgical techniques, and they can't control the accumulation of fluid, they'll apply leeches to those as well. Well, this is one of the more fascinating stories of the Renaissance and the health issues that they encountered in those days. Antonio Darmino was called to see the 20-year-old son of the Duke, who acquired what was called the French disease. Now, it was called the French disease because when the French army came to Italy to besiege the city of Naples, they happened to carry with them the germ that causes syphilis. And they infected a number of people in that area. And it was for that reason called the French disease. Well, the Russians called it the Polish disease. The Polish called it the Russian disease. And if you didn't like the person you were fighting in battle, you named the disease of syphilis after them, because syphilis is something that went through armies like gangbusters because of the camp followers that accompanied all those armies. Most likely, syphilis came from the Caribbean area, brought back by the crew of Columbus. And the disease that we know of, syphilis, was kind of common in the New World. We know that. But the reason I have the question mark there is because there is still some disagreement about where syphilis came from. But the general consensus among infectious disease specialists is that the Columbus's crew brought it to Europe, and it spread very rapidly throughout Europe. One of the unusual things about syphilis during that time was that it was a very highly disfiguring disease that caused severe ulcers, and sometimes an ear would fall off, or a nose would fall off, or a chunk of face would fall off. And it was a very destructive process. But for some reason, and no one is quite sure, in the couple of hundred years that followed the Renaissance, syphilis became a much less disfiguring disease. And now it looks like it's a more benign disease because it doesn't cause your nose to fall off, but it can still cause severe problems. It can cause problems later on developing in the joints or the heart or the brain. And in years past, 100 years ago, syphilis, in fact, was one of the leading causes of heart disease in the United States. Well, we still see syphilis. There are about 40,000 cases per year that occur in the United States. The vast majority occur among the gay population. The good news is that it is easily treated by penicillin. It's one of the most sensitive germs to penicillin. And we used to joke that you could simply wave a container of penicillin tablets under the nose of a person with syphilis and they get better. Well, it's not quite that effective, but a simple shot will take care of it in most cases. The tragedy is that much of this goes unreported because of the nature of the people in which it occurs, prostitutes, etc. And we're still seeing dozens of cases of syphilis among babies in the United States, something called congenital syphilis, which has a devastating effect, and many of them don't survive. Well, this is a nose that was worn by people during the Renaissance when their nose fell off from syphilis. And they would literally go to social gatherings wearing a prosthesis like this, because in those days, pretty much everybody got syphilis. It was extremely common. Those people were extremely promiscuous. And so it was no big deal to have syphilis. And so this kind of artificial nose, could be made out of leather or could be made out of silver or gold if you had enough money, was very common. Well, this was a common way of treating syphilis. Now, the syphilis germ is very sensitive to heat. And so the doctor would simply place this patient into this chamber where there was a fire burning, and it would heat up the chamber. The patient would develop a very high fever secondary to heat, and the germ would die. And this actually turned out fairly effective. So he put his young charge into that hot barrel, but he probably also gave him some mercury, because it was recognized that mercury could kill the germ that caused syphilis, but it also caused severe kidney damage, very common, and it had to be given on a regular basis. And so the one of the phrases that became a kind of a watchword during that period was "one night with Venus, a lifetime with Mercury." And since mercury also produced some fever, that was also one of the benefits of it. And one of the things that was very common before we had penicillin treatment for syphilis is that patients with syphilis would be given an injection of malaria parasites. There are 4 different strains of malaria. One of them is quite benign. And so patients would be injected with malaria, and they would get fever every 2 or 3 days. And the fever that was induced by the malaria would be enough to kill the syphilis germ. And it really did work. It seems strange to exchange one condition for another, but that kind of malaria was very benign, but syphilis can be fatal. There are some methods that there were used in that period of time, one of which was honey, another was willow tea, another one was cautery, there was delayed wound closure, opiates, cataract removal, and autopsies. And we use all these things today. Now, let's look at honey, for instance. Honey was often poured into wounds. And the reason it worked was that honey would literally suck water out of a wound, and it would also kill germs that were present in the wound if there were not many of them. Well, interestingly enough, it was still used until fairly recently in certain places where patients were kept for long periods of time and would develop bed sores. And one way of treating bed sores, even when I was in medical school, we're talking 60 years ago, not all that long ago, was when a patient developed bed sores. And back then we really didn't know enough how to eliminate them completely. But the nurses would pour table sugar or honey into a bed sore, and it would heal faster, because a concentrated sugar or concentrated honey would keep germs from growing and allow the bed sore to heal. Sounds pretty gross, but we were doing that not too long ago. They also knew that willow tea could bring down fever. Well, willow is a source of what's called salicylates, and willow is something that we still use, except that we use it in the form of aspirin. We still use cautery during surgery, except we don't apply a red hot iron to a surgical wound. We now just zap it with a little gun that looks like one of these hobby type guns. And by simply electrocuting the tip of the blood vessel, it causes it to burn and stops the bleeding immediately. We still use delayed wound closure, and especially if someone has a wound that's more than 24 to 48 hours old, we simply allow it to heal by filling in instead of closing it, because we know that if we close it with sutures, that might cause an infection. Well, they use opiates then for various things. When we use opiates now, we certainly use things like morphine to relieve pain in people with severe pain, and things like codeine, which is an opiate type derivative. And as I mentioned, we still remove cataracts, except we don't do it by pushing the cataract into the eyeball, letting it drop down. We actually remove the cataract and replace it with something that works. And of course, autopsies are a regular part of medical practice these days, even though you have probably heard that there is a very dramatic decline in the number of autopsies that are performed these days for a variety of reasons. One is which they're expensive, and sometimes the family is obligated to pay for an autopsy. We don't use them as much as we used to. Well, for a long time, autopsies were prohibited, sometimes by the civil authorities, sometimes by the church authorities. However, because they couldn't do autopsies, as I mentioned, in the time of Galen, he got his information about human anatomy by dissecting pigs and monkeys and chimpanzees, which are not quite the same as humans. But eventually, during the time of the Renaissance, they loosened the rules so that it was allowed for physicians to do autopsies. And in order to learn more, the autopsy was done on criminals, and they were done by professors of anatomy. And there were two things about this. And one was that they were often, the executions of those criminals was often scheduled for the convenience of the anatomy professors. Never get that through the ethics committee these days. But also, most autopsies were done in the winter. Remember that they didn't have refrigerated morgues, and they had no way of keeping bodies cool. And so if you did an autopsy in the summertime, you were inviting some real challenges, and not many students would come to see an autopsy in July or August. Well, many people are familiar with this person. Leonardo Da Vinci was a remarkable individual. There's probably been no one like him since then. He lived in the 15th and into the 16th century. And he was actually born out of wedlock to a notary, a fairly well-to-do individual and a peasant woman. And his father didn't really acknowledge him completely, so he farmed him out as an apprentice to a famous artist. And every time I look at that line, I wonder what would have happened if Leonardo da Vinci had been apprenticed to a shoemaker instead of an artist, a famous artist. He might have been a real good shoemaker, but we may never have learned about the remarkable things he did during his long career. Now, Da Vinci was allowed to do autopsies, and that's he was able to do dissections to develop information about human anatomy. However, he knew that even though the civil authorities said it's okay to do autopsies now, he knew that if a different administration came into power 10 or 15 years later, they would say, we're going to prosecute you because you did an unlawful act, even though it was lawful at that time. So those drawings of his autopsy were never published during his time, but these are the kinds of detailed drawings that he did from the dissections that he did, and there were hundreds of these. And I would comment that, as many of you know probably, that he wrote in mirror writing, and he wrote backwards so that you could only read what he wrote by holding it up to a mirror. And boy, you talk about a talent. It is really remarkable how he was able to do that. Well, they anticipated the germ theory at that time. I remember I mentioned that they didn't have any idea how diseases spread, because microscopes were not available until the 17th century. And although they knew that syphilis spread from one person to another, they didn't know how it spread. They thought it was by some sort of imbalance of humors. And some physicians during the Renaissance thought that some sort of seeds spread from one person to another, but they had no idea what that could be. And it wasn't until Pasteur studies of the late 19th century that the germ theory was developed. And even then, it took 30 or 40 years before many people in the medical and scientific world accepted Pasteur's findings and finally admitted that there was no such thing as what was called spontaneous generation. There were some wonderful legacies that came from the Renaissance. One was the empiric method that I mentioned. They no longer accepted authority, and they began to do experiments and find things that the old mentors never even dreamed about. And they also emphasized the importance of the individual, which had a great deal to do even with how the United States was formed, because that was the beginning of the Enlightenment and the ideas that individuals could be responsible for their own existence, and we no longer had to bow down to authority. And this is a typical example of what a little girl, a little 5-year-old would look like during the Renaissance. And this little girl's father happens to be a photographer who has a wonderful capacity to control and manipulate light. And he used his little girl as a model for these. This is another one. This is someone you might very well encounter in Florence in the 16th century. And this is someone you might also find, for instance, in, say, in Holland at that time. And I just fell in love with this little girl when I saw the wonderful photographs that he took of her. And that is how we'll end our presentation. I would be happy to answer any questions you might have.
Well, thank you so much, Dr. Goscienski. And we will now open up for questions. My name is Dante Farenga, and I'm the Development and Marketing Director here at the San Diego Archaeological Center, and I will be moderating tonight's discussion portion. Just as a reminder, you can submit your questions using the Q&A feature. And our first question was, what year was the example for the daytime physician?
I'm sorry, say that again.
Sorry, what year was that physician example from, the day in the life of a physician?
Oh, probably about sometime in the 1500s. It's strictly a fictional character, but these, the kinds of diseases that he saw and treated spanned that entire period. I just happened to pick that particular one, was probably in the 16th century.
And what was the average life expectancy during this period? And did it differ for men and women?
Well, it differed from men and women because men didn't deliver babies. And they had no way of dealing with the complications of labor and childbirth. And so many women died of pregnancy complications. As a matter of fact, if you read the biographies of men who lived in that period, right up until the beginning of the 20th century, when we finally could do C-sections safely, many biographies will include the fact that a man had 2 or 3 wives because he lost 1 or 2 in the course of delivering children. It's very common. So in that sense, women had a greater mortality rate. Now, when it came to the life expectancy, there's no way of knowing that. The term life expectancy is a meaningless term. It is only useful if you're looking at demographics and looking at changes in public health measure over the years. Life expectancy, for instance, of a family in which the mother and the father both die at 50, they have 2 children. One dies at 6 months of age. The other lives until the age of 100. The average life expectancy for all those people is 50, which is absolutely meaningless. And one of the reasons life expectancy was very low statistically during that period was because childhood mortality was so high. During the Renaissance period, about 1 child in 4 never made it beyond the first year of life. And it was very common for 2 or 3 children out of 4 to not survive to the age of 10 or 12. when you compare that with what we see today, where life expectancy or the childhood mortality is extremely low, there is no change. So most of the improvement that we see in life expectancy began in about 1900 for two reasons. One was we began to develop indoor plumbing, which eliminated large swaths of disease. The other was because at that time, gastroenteritis, diarrhea, killed most children. Most children who died in those days died of gastroenteritis. And when we began to control things like hygiene, things began to improve dramatically. And in the early 19th century, early 20th century, when we developed things like vaccines against diphtheria and tetanus, we saw another dramatic increase in life expectancy. And that's simply because children were living longer. Had nothing to do with old people living longer. We all know that Benjamin Franklin lived to a ripe old age, that Michelangelo lived to about, I think Michelangelo died at about 89, and so did Da Vinci. And so even Socrates died in his 80s and by his own hand. And many people in ancient Rome died in their 80s and 90s. So life expectancy is an artificial figure, and it's not useful except to people who study populations.
All right. Someone said they heard that germs were first observed long before their association with disease. Scientists thought they were tiny animals. Is this true?
Correct. A Dutch optician, a lens maker in Holland, began to examine various things like saliva and scrapings from his gums and dirt and various other things using tiny lenses in which he saw tiny creatures moving around, and he called them animalcules. And he presented his findings to the Royal Society in England, was praised for his work, and that's where microscopes began to develop. But it wasn't until Pasteur came along in the 1860s and 70s and developed his proofs that bacteria existed. I'll give you an example of how tragic that was, that took so long. One of the talks I give has to do with Ignaz Semmelweis. It's a talk that I give on medicine's greatest controversies, which I gave not too long ago. But Semmelweis realized that women were dying and babies were dying of what they knew was called childbed fever, and what we now know as puerperal sepsis caused by a strep germ, same thing that causes strep throats. And Semmelweis recognized that these were contagious diseases, but they had no way of studying them at that time. There were no laboratories that could grow this germ, which grows very easily, by the way, in the laboratory. So they simply didn't know of the association between those tiny creatures that Antti Leeuwenhoek discovered in the, I guess it was about the beginning of the 18th century, and what was finally deduced 200 years later by Louis Pasteur.
All right, and I think we have time for one final question. Given the current pandemic, do you foresee humans experiencing another devastating viral disease with as much as a population wipeout as the Black Death had?
Yes. Simple answer, yes. We will continue to see these kinds of things happening. It's not likely that we will ever be able to control them. Bacteria and viruses have remarkable means of surviving when we come up with all kinds of ways of eliminating them. They also reproduce at rates in huge rates, and exponentially greater than humans reproduce. And because of the fact that bacteria and viruses change so much, and they can adapt to those changing situations that we throw at them, like antibiotics and antivirals, there will always be some virus or bacterium that comes along that will cause severe devastation. Now, probably will never be as serious as the Black Death. Probably will not even be as serious as the Great Influenza or the Spanish flu of 100 years ago. And the reason for that is our technology. We no longer have to simply stand by or run away from germs as they did in the years of the Black Death and to take measures to stay away from each other, which they tried to do unsuccessfully in 1918, 1919. But we now have techniques that can actually combat these infections. Looking at the current pandemic, for instance, when it comes to preventing them, we are coming up with a vaccine, which is going to be released in a matter of days, which probably will work most of the time. The reason I hedge a little bit is because we won't know how effective the coronavirus vaccine is for about a year, because people who are vaccinated will have to then be exposed again to the natural virus before we know whether it's working or not. There are about 150 different vaccines being developed. And so even though I'm sure that the earliest ones will not provide lifelong protection, I'm convinced that within 2 or 3 years, some of these 150 candidates will come forward and will in fact give us a lifetime immunity. One of the silver linings of this pandemic is vaccine technology. Now, as you know, you have to get influenza virus vaccine every year, and I hope that everybody does, because this is whether or not we're going to see a bad flu or not. We have flu plus coronavirus, both of which do great damage to older people. But I have a feeling that this enormous effort that's being put into vaccines is going to finally give us a flu vaccine, which can be given only once and will last literally for decades. So I think that's going to happen. So I don't think we're ever going to see a devastating influenza like we had 100 years ago. If we look 100 years ago, the Spanish flu, which had nothing to do, by the way, with Spain, but the Spanish flu killed probably about 50 million people throughout the world at a time when there were fewer than 2 billion people on the planet. So if we multiply that by, say, 3.5, because we now have 7 billion people living on the world, we're looking at 150 million people dying. And some authorities feel that as many as 100 million people died during the Spanish flu. That might be an exaggeration, but it might not. And the reason I can't come up with a firm figure is because different countries had different ways of recording deaths. Some of them were not even aware that they were dealing with influenza. And so literally millions of people died during that time. And it was not recognized that they died of influenza. So we will never have an accurate number. Now we can get fairly accurate numbers if people report the disease honestly. And unfortunately, not everybody, even in this current pandemic, did that. That's another whole other topic.
Well, thank you so much, Dr. Goscienski, for tonight's talk.
You're very welcome. It's a pleasure to be with you.
And thank you also to everyone who's attended tonight's Living Room Lecture. The series continues in January with ironworking in Togo, West Africa. And for more information on this and our other upcoming events, please see our website, sandiegoarchaeology.org. Thank you and good night.